Welcome back to the Exam Room Nutrition Podcast. I'm Colleen, a PA, dietitian, and your nutrition mentor. I hope you've been enjoying these episodes as much as I have. It's been so fun hearing from you on LinkedIn and Instagram about how helpful these cases are. Courtney, a PA student, reached out and told me this was a fantastic case study question. We are currently taking our final exams for neuropsych, and this was one of our presentations. I love that. And I love hearing from you. So if you're enjoying these cases, can you send me a message on Instagram or LinkedIn just letting me know? You can find me at Exam Room Nutrition. But if you're just joining me, let me catch you up. The last few episodes have been shorty episodes in a mini-series called Deficiency Detectives, in which you're presented with a curious case, and your job is to guess which nutrient deficiency might be causing our patient's symptoms. You can submit your guess online and receive instant feedback from me, plus a chance to win an entire year free of nutrition grand rounds. This is a monthly virtual workshop launching in January, and it's packed with expert nutrition presentations you won't want to miss. So let's reveal the last episode's deficiency. In episode 86, you met Josh, a 12-year-old with cystic fibrosis, muscle weakness, absent deep tendon reflexes, and he's non-compliant with taking his vitamins. So what was Josh's deficiency? If you guessed vitamin E, you're right. Vitamin E is a fat-soluble vitamin that occurs naturally in 8 different forms called isoforms. Now, the most biologically active and the only form that is recognized to meet human requirements in the U.S. by the Institute of Medicine and the Dietary Guidelines for Americans is alpha-tocopherol, but beta, gamma, and delta tocopherols, 4 tocotrienols, and several stereoisomers may also have important biological activity. In addition to its activities as an antioxidant, vitamin E is involved in immune function, cell signaling, regulation of gene expression, and other metabolic processes. Vitamin E also inhibits the activity of protein kinase C, an enzyme involved in cell proliferation and differentiation in smooth muscle cells, platelets, and monocytes. Vitamin E also serves to promote blood vessel dilation and reduces platelet aggregation. Now, a final fun fact about the function of vitamin E, and I have to give a quick shout out to my friend and previous podcast guest, Dr. Douglas Kalman, for sharing this information with me. Vitamin E is needed for both spermatogenesis and steroidogenesis via action on the Leydig cells and for testosterone production. Now, I bet you didn't know that the pituitary gland contains vitamin E receptors, and the pituitary impacts gonadal activity. Vitamin E promotes testosterone production in men. It does this via stimulation of pituitary gonadotropins and testicular testosterone production. And this raises a really interesting question about a possible resurgence in the popularity of vitamin E for health, especially in men's health. All right, let's discuss the causes of vitamin E deficiency. Although the deficiency is rare, it can occur in individuals with food insecurity and poor oral intake. It's also seen in disorders that cause fat malabsorption, including A-beta lipoproteinemia, also known as Basson-Cornswig's syndrome, due to genetic absence of apolipoprotein B, chronic cholestatic hepatobiliary disease, pancreatitis, short bowel syndrome, and cystic fibrosis, like our patient Josh. So let's pause here a moment and talk about cystic fibrosis. Cystic fibrosis, or CF for short, is an inherited disease of the exocrine glands, affecting primarily the gastrointestinal and respiratory systems. It leads to chronic lung disease, exocrine pancreatic insufficiency, hepatobiliary disease, and abnormally high sweat electrolytes. Diagnosis is by sweat test or identification of 2 cystic fibrosis causing gene variants in patients with a positive newborn screening test result or characteristic clinical features. People with CF have trouble absorbing fats, which means they have trouble absorbing vitamins that need fat to be absorbed, and that includes vitamin A, D, E, and K. These fat-soluble vitamins are critical to normal growth and good nutrition. And approximately 85 to 90% of people with CF do not produce enough enzymes in their pancreas, and they're not able to absorb fat when digesting food. They also are likely to have problems absorbing the fat-soluble vitamins, hence why they need to be on lifelong pancreatic enzymes and vitamin and mineral supplement. So what are the symptoms of vitamin E deficiency? Now, the main symptoms are mild hemolytic anemia and nonspecific neurological deficits. Now, in children with chronic cholestatic hepatobiliary disease or cystic fibrosis, a deficiency can cause neurological deficits, including spinocerebellar ataxia with loss of deep tendon reflexes, truncal and limb ataxia, loss of vibration and position senses, muscle weakness, ptosis, and dysarthria. Now, in adults with malabsorption, vitamin E deficiency very rarely causes spinocerebral ataxia because adults have large vitamin E stores in adipose tissues. Now, where do we get vitamin E from? Numerous foods provide vitamin E, including nuts, seeds, and vegetable oils, which are among the best sources of alpha tocopherol, and significant amounts are available in green leafy vegetables and fortified cereals. Now, the best sources include sunflower seeds. Just 1 ounce of sunflower seeds provides 7.4 milligrams, or half of your daily needs. Almonds come in at a close second, providing 6.8 milligrams and 45% of your daily needs. And half a cup of spinach provides 1.9 milligrams, or 13% of your daily needs. Now, there are a few drug-nutrient interactions to be aware of, including anticoagulant and antiplatelet medications, simvastatin, and niacin. And patients on chemotherapy are often advised against the use of antioxidant supplements during cancer chemotherapy or radiation therapy because they might reduce the effectiveness of these therapies by inhibiting cellular oxidative damage in cancerous cells. And so what's the treatment? Now, in patients with inadequate intake or a predisposing condition, plus those compatible neurological findings, you should measure the alpha tocopherol levels to confirm the diagnosis and treat it with supplemental tocopherol. Now, besides eating a nutritious diet, patients with CF need to be encouraged to take a CF-specific multivitamin supplement. These supplements for people who have CF can come in pills, soft gel capsules, chewable tablets, or even liquid drops for children. Now, although patients with cystic fibrosis should have a dedicated CF team, they'll often pop into the primary's office with vague symptoms. And now you'll look like a genius if you come across a case like this. So this was our last case to solve, but check back tomorrow as I announce the winner of the Nutrition Grand Rounds complimentary access. Plus, I'll be sharing my top tips for helping patients navigate the holidays if they're trying to stay on their health goals. Now, if you're like, what is the Nutrition Grand Rounds, Colleen? I am super pumped about this program I'm launching in January, where I'm inviting leading experts in nutrition and medicine to go even deeper than my podcast does on a variety of nutrition topics. I've already got a dietitian going over GLP-1 medications and managing those side effects, a physician helping us understand PCOS, a mental health dietitian teaching us the best practices for helping patients with anxiety, depression, and ADHD, and so much more lined up. Now, you'll hear more about this program in the coming weeks, but for now, mark your calendars for January 8th, which will be our very first presentation. Well, thanks for being here, and I will see you next time, friend. Same time, same place.